Hello, everyone. I have Dr. Jimmy Cortez from Tijuana, Mexico with us today. I was able to get him for a couple of minutes, so let's make sure that we take advantage of it. I just wanted to get him on the line because a lot of people DM me all the time. They have questions about how I found the clinic, who I work with, who did the work for me. So I wanted to have him on. And if you want to go ahead and introduce yourself, Jimmy, and just tell us a little bit about yourself.
Yes, I'm Dr. Jorge Jimmy Cortez. I'm from Tijuana, Mexico, from the clinic Capilar Hair Center. What's up, Salvador?
Not much, not much. So I'm gonna ask you a couple of questions, Jimmy, that people DM me all the time, and then if you want to just kind of answer them for me, I'm sure it's going to be helpful to a lot of people. So to start, if you can kind of just give us a little bit about your background and how you got into doing hair
Yeah.
transplants.
So I've been doing this I see some pictures like around 11, 12 years ago in Congress. It's gonna be like 12, 13 years I started with this. Um, because your first surgery was there.
Yeah,
I start with my brother, HMR. Her medical restoration is here in Tijuana too. So we
yeah.
started this clinic, and recently, like I think like 1.5, 2 years, I opened this clinic, Capilar Hair Center,
Hmm.
and I've been doing this for a while. Yeah.
Okay, awesome, man. Did you initially start off doing this? Was this like your goal to do, or you somehow got into doing this another way?
When I start this, it's only like 3% here in the city doing this. Right now, I think
Uh-huh.
we are like 25, 30. I don't know.
Yeah,
So basically, it's like I need it. The results always is the most of the time so great. Uh, there is some like things, small things like there is no emergencies or the normally zero complications. That is a good thing to do.
yeah. No, that's awesome. And another question that a lot of people have is, what makes somebody a good candidate? I know that, for example, with me, I sent over some pictures to you, and then based off that, you let me know if I was a good candidate. Is that still what do you look for? I guess when people are sending over the pictures to you.
Okay, so I think the first is the age.
Hmm.
Normally we don't do on the very young people.
Hmm.
Let's say up to 25.
Yeah.
Uh, I have experience in person patients. They come like 80 years old and they still want
Mhm.
the transplant. But
Yeah.
you have to respect that.
Yeah.
Women's or men's is the same. They're candidates, but probably the main part is the donor area. I think is the most important part. If
Uh,
the patient doesn't have a good donor area, we cannot do nothing.
yeah.
Uh, and you have to evaluate the donor area with the needs. Okay, if the person have a medium donor area but a big spot in the top,
Yeah.
probably he is not a good candidate because the result will not be great.
Got you. Okay. Yeah, and that's one thing I appreciated because I see a lot of people, a lot of clinics will just take on anybody, to be honest, just kind of to make money. And I think one thing I've always liked about working with you is that you've always been upfront. You've never like I've never felt that you're trying to do something for your benefit. It's always been for the benefit of your clients. So I really appreciate that. It says a lot about you.
Yeah,
Another question.
sometimes you have to say no
Yeah.
because probably will be worse for the rest of the life of the patient.
Yeah.
Uh, you can get a trouble too,
Yeah.
and
No, for
the
sure.
surgery or that.
Okay. And then what's some things that you love about your job, and then what are things that you don't like about your job, if there's any?
Um, I don't like my job. Sometimes it's too tired. Sometimes it's too tired. Too many hours in the office.
Uh-huh.
Uh, that's why we put a limit in the graphs. Okay.
Oh, okay.
I don't like to do more than 3,000.
Yeah.
I'm a human, so it's tired. Okay.
Yeah.
Uh, what else? I think that it's just small things, but I love the interaction with my patients.
Hmm.
Uh, of course the message that they send me after the results. They say beautiful things like "you changed my life,"
Yeah.
and things like that. Probably that is the more I like it.
No, for sure. And then another question: how long does it typically take for clients to see results?
That is a good question. So everything starts with the implants, all right?
Hmm.
A few scabs they will come in the next first week. After 2 weeks, the transplanted hair falls from the
Hmm.
third week to the third month. Okay. After the third month, the hair will start to grow like baby hair. I just received a call today.
Hmm.
The patient is on 2 months mark, so he expect, hey, what happened with my hair?
Oh, wow.
You have to tell him again. Oh, you know what? The hair will start from the third month, and it's not a came like you're gonna have a lot of hair. Like they will start to grow like baby hair, and the
Yeah.
result 6 months will be like 50, 55, and the final result will be until 1 year. Okay.
Hmm. Okay. And then I've heard in different groups and just people bring it up in like Reddit and TikTok, but what's the difference between the DHI, or is that what it's called?
Yeah,
What?
yeah, yeah.
Yeah.
So the ones you receive is DHI. It's just the names. So basically, FUE is for extract. Okay, so you extract one by one the
Mhm.
grafts. Okay, the other one FUT is with a cut. I will say very simple. In to implant, there is a different ways to implant the hairs. Some doctors do made a hole, a lot of holes. After that,
Yeah.
with a forceps, put the hair. Okay, and you made a hole with a sapphire tool. So they say,
Hmm.
oh, this is the technique, the sapphire technique. So DHI is use like a device. I do this all my career. So it's a device. You put the hair in there. Uh, the needle will go in, and you push the hair. So it's less damage. That is the DHI, the red implant.
Okay. Do they give you different results, or they're pretty similar? It's just
I
a
never,
different.
I never, I never use the other technique. It's a lot more cheaper the other one
Mhm.
because you don't have to buy a new
Oh,
needles. The
yeah.
needles are a little bit expensive, but I don't know why they use the other one. I respect that, but I like this one. I think
I,
this is a more natural. Also, the more natural results.
okay. And then, what do you recommend your clients after they do the hair transplant, like the aftercare, once it's done?
The aftercare is different for each patient, but the common indication is keep away from the sun, keep away from the pool, keep away from the
All the fun stuff.
yeah, for at least for 3 months. Okay, no sauna, no steam room, things like that. For no chemics for all the hair.
Okay.
After 3 months, you can do everything. Okay,
Hmm.
and for medical stuff, I believe some doctors not, but I believe PRP is very good option. After
Hmm.
after 1 month, 3 months, 6 months, I think those are the best. It's like a booster. It's contain growth factors, and I have very good experience. Here, accelerated healing process. The finasteride, I know we're men, so we are a little bit afraid from that.
Yeah.
I say I even use the finasteride, the shampoo.
Hmm.
To be honest, I don't want to use the other one. I use the shampoo, very simple. Compared with the pill,
Yeah.
it's not a big difference. But of course, some patients need the pill, so that's why that's why they exist. So it's a personal evaluation for every patient.
Got it. And then last thing, what are your plans for Capilar Hair Center in the future? What do you plan to do? And then is there anything that you want, potential clients or people that are going to watch this video to know about you or the clinic?
Yeah, so we have grown very very faster. I think as I always be super honest with my patients. Uh, Probably we're gonna open a clinic in Arizona. We don't. we wait for that.
Mm-hmm.
Yeah, and that's it. For the patients gonna see this video, and my advice is don't even think. Watch the doctor you gonna is gonna treat you. Okay, the doctor, if he has to perform your surgery. Okay, don't go with the technicians. I don't have nothing about the technicians. Some ones are very good, but I think if the doctor perform your surgeries will be better. Okay. Also, he won't know if something goes bad or what happened in the surgery. Okay. So that
Yeah.
is, I think that is my advice. Follow the indications they give you. I think that's it, man.
Yeah, no, I agree, and you know what? I think that's one of the reasons why I wanted to go to your clinic because I heard that you were doing all the surgeries yourself. You weren't handing off the work to anybody else, you know, and the work speaks for itself. I'm very happy with the results, and like you mentioned earlier, you know, I think the first time that I mentioned that I went is because I wanted you know, for my wedding, and I'm happy. I'm very happy. I did it. My wedding pictures look awesome. I don't look like I'm missing half my hair. So I really, really appreciate it. It's definitely been a game changer with my confidence too. I feel more confident about, you know, my hair and just you know, being out and about. So thanks so much again. Thank you for your time. I know that you're very, very busy, so it's hard
Yeah.
to get locked down for some time, but I really appreciate it. You know, and any other questions that I have, please find them on Instagram, guys. Capilar Hair Center, also on TikTok or on their website. You'll see the reviews. You'll see some pictures on there as well and on their website. And that's pretty much it. Thank you so much, Jimmy, again for your time. And we'll talk to you, okay?
Thank you, my friend. See you guys. Take care.